Okay, think about your really sensitive information, stuff you definitely wouldn't just, share with anyone.
Yeah.
For pretty much everyone, I bet health data is right up there.
Yeah.
Your diagnoses, medications, test results, even mental health notes. It's super personal.
Absolutely. Your medical history, it's basically a blueprint of your physical, your mental well-being.
Mm.
And now, well, so much of it is electronic, right?
Right.
So protecting it, that's become this huge challenge.
It really has.
Yeah.
And the risk of that information getting out without your permission, it's very real. That's exactly why we're doing this deep dive today. We're looking at medical data breaches. We've got quite a bit of material here covering what they are, why they happen.
The consequences, too.
Yeah, the consequence for people involved, and maybe most importantly for you listening, what happens with notification if your data gets compromised? We really want to help you understand this whole landscape.
Yeah, the risks and what the rules are around, telling people.
So what exactly is a medical data breach based on what we're seeing?
Well, looking at the sources, it's basically the wrongful disclosure of health information that can identify you. You often hear it called PHI, protected health information.
PHI, right.
So it's when that sensitive patient data is accessed or used or shared in a way that violates privacy laws. It wasn't authorized.
And this isn't some, rare thing affecting just a few people, is it? The scale sounds pretty big.
Oh, it's huge. Honestly, the numbers are staggering.
Yeah.
The sources show that these PHI breaches in the U.S., they've affected over 176 million patients.
Wow.
Yeah, and one source specifically tracking since late 2009 puts it over 173 million people.
173 million.
When you think about the whole U.S. population, that is a lot of people whose very private health info has been exposed.
Okay, over 170 million, yeah. So when you hear numbers like that, you probably think, okay, sophisticated cyber attacks, right? Hackers.
That's a common image, but...
But what do the sources actually say are the main causes?
Well, the material kind of breaks the threats down. You've got human threats. It's everything from, hackers trying to get in to employees just making mistakes. Then there are natural and environmental threats, fires, earthquakes, things that could just destroy the systems holding the data. And then just technology failures, system crashes, software bugs, stuff like that.
And these can come from inside or outside, be accidental or deliberate.
Exactly, both. But here's where it gets really interesting and maybe flips what most people assume.
Okay.
While those external attacks are definitely a serious worry, the sources we looked at really highlight something surprising. Most breaches in the U.S., they've actually come from employee negligence and noncompliance, not sophisticated hacking.
Employee negligence, really, that feels backwards somehow. We picture these high-tech attacks, but you're saying the biggest weak spot is often just human error.
Pretty much, yeah.
How does that even happen in, a hospital or a clinic?
Well, often it's not malicious, it's oversight or maybe lack of training. It could be something really simple, like talk about patient information too loudly where people in the waiting room can hear.
Oh, wow.
Or writing the wrong details on a form that then gets sent somewhere it shouldn't.
Oh.
Or maybe healthcare workers just aren't fully up on security rules. They click a bad link in an email or misplace a phone or laptop.
Simple things.
Yeah, seemingly small mistakes. But scale that up across a big organization and suddenly huge amounts of sensitive data are at risk.
Can you give us some specific examples, maybe some slightly cringe-worthy ones from the sources that really show how this happens?
Oh, yeah, absolutely. The material has several that really paint a picture. There's one case, hospital staff discussing a patient's HIV test results out loud in a packed waiting room.
Oh, my goodness.
Imagine how public that is for something so private. Then there's an office manager who accidentally faxed confidential psychiatric records to the wrong number, ended up at a totally unrelated company. Then you have things like losing unencrypted devices. A private practice lost a flash drive just full of patient info.
And encrypted, too.
Exactly. And yeah, there are also cases where staff, even a surgeon in one instance, illegally accessed celebrity medical records. Just curiosity, or maybe gossip, led to them losing their jobs, facing penalties.
And social media.
Yep, even sharing seemingly harmless patient details on social media has caused serious trouble.
Those examples really drive it home. It's not just the big cyber attacks, it's these human things too. Sometimes accidental, sometimes not. So what happens? If an organization or an individual is responsible, what are the consequences?
They can be pretty significant.
Right.
For the organization and sometimes for the individuals involved, too. It's not just, an internal warning.
Right.
Wrongfully disclosing this identifiable health information, that's legally defined as an offense. And depending on the details, like, did they know about it? Was it just reasonable cause? Or was it deliberate, willful neglect? You can face both civil and criminal prosecution.
Civil and criminal. Okay, what kind of penalties are we actually talking about here? Can you lay out the specifics from the sources?
Okay, so the penalties vary based on how bad it was and the intent. On the civil side, if it's a violation they didn't even know about, the minimum is like $100 per violation.
Okay.
If it was due to willful neglect, but they fix it, penalties can go up to $50,000 per violation with annual caps. But, and this is key, if it willful neglect and they don't fix it, then it jumps big time, $50,000 per violation with an annual maximum of $1.5 million.
Wow. Okay. So not fixing a known problem is really penalized. What about the criminal side? Is actual jail time possible?
Yes, it is.
Yeah.
Again, it depends on the intent. If someone knowingly obtains or discloses identifiable health info, that could mean a fine up to $50,000 and up to 1 year in prison.
1 year.
If they did it under false pretenses, like lying about why they needed the data, fines up to $100,000, prison up to 5 years.
5 years.
And for the really serious stuff, doing it for commercial gain, personal profit, or to deliberately harm someone, fines can hit $250,000 and prison time up to 10 years.
10 years.
Yeah. And the sources do mention real examples of employees getting jail time and organizations facing massive multi-million-dollar fines because of these violations. It's definitely serious.
It absolutely sounds like it. Okay, let's shift focus a bit. Back to the patient, the person whose data might have been exposed. If my sensitive health info is breached, how do I even find out? Do they have to tell me?
Yes, breach notification. That's a really critical piece of this whole thing, and it's designed specifically for you, the patient.
Okay.
The idea is basically two things. First, tell the affected people so they can take steps to, limit the damage. Change passwords, watch for identity theft, that kind of thing.
Makes sense.
And second, it pushes organizations to actually improve their security so it doesn't happen again. And yes, in the U.S., the law requires these entities to tell individuals if there's a breach of their unsecured protected health information.
So if my data gets breached, I should expect someone to contact me. Is that the standard everywhere, though?
It's a standard in many places, yeah, but there are definitely variations. The material we looked at contrasts the U.S. approach with, say, the EU directive.
How's it different in the EU?
Well, in the EU, notification is generally required only when the breach is likely to adversely affect your privacy as an individual.
Likely to adversely affect.
Okay, the U.S. law, while it has that general requirement to inform, it also includes some specific exemptions that might mean you don't get notified in certain situations.
Exemptions? Like what? What would stop me from getting notified even if my data was technically accessed?
Well, the U.S. law has exceptions for things like unintentional access or use of the information within the organization, as long as it was done in good faith and didn't lead to more sharing. Another one is if there's an accidental disclosure between two people who are both authorized to see the data, again, if it's in good faith and doesn't get disclosed further. The sources also point out, though, that figuring out the actual potential harm from a health data breach, that can be really complicated.
So it's not always black and white. Breach happens, notification follows. There are nuances.
Definitely nuances.
Which really highlights this tension, doesn't it? I mean, electronic health records, EHRs, they offer huge benefits, right? Sharing info easily, tracking treatments better, communication.
There's huge benefits, yeah.
But balancing all that good stuff with really strong privacy protection, that's the constant tightrope walk.
It really is. That balance is absolutely key. You want your doctors to have what they need to treat you well, especially if you see multiple specialists, right?
Of course.
But you also need to feel confident that info isn't just going to wander off somewhere it shouldn't.
So are there examples out there, systems trying to manage this balance better? Maybe giving patients more direct control, but still letting the necessary data flow?
Yes, actually. The sources mention systems like the Ayushman Bharat Health Accounts, ABHA, in India. It's an example of a digital health record system designed really with patient control front and center.
Patient control. How does that work in a system like ABHA?
Well, the core idea is that you, the individual, own your data. The material explains that with systems like this, only you can choose to share your own records with other doctors or clinics, even if they use different systems.
Only me.
Only you. and only after you give explicit consent. And what's interesting is that consent can be really specific or granular, as they call it.
Granular, meaning?
Meaning you can choose to share just one specific record, maybe just your latest lab results, not your entire medical history going back years.
Ah, okay. That does put a lot more power back with the patient. What about the other big concern, though? Governments using all this aggregated data for policy or research?
That's a really crucial question, yeah. And the sources address it for systems like ABHA. They state that the protocols for making data anonymous and aggregating it, they will be defined first.
Defined how?
Through consultations with stakeholders, specifically to make sure privacy is baked in. After those protocols are set, then yes, anonymous, aggregated records can be used by the government for policymaking, public health stuff, like understanding disease trends.
But only anonymous and aggregated.
Exactly. And crucially, the sources are very clear. Until these protocols are fully worked out and established, the records are not intended for government use at all. The focus is squarely on using anonymized data for population insights, not looking at individual records without your specific informed permission.
Okay, that helps clarify how systems can be designed thinking about both usefulness and privacy, even for those broader public health goals. It really seems like this balancing act, the potential of EHR, strong security, patient control, it's just essential now.
It absolutely is. Regulations like HIPAA in the U.S., they provide a framework to try and lessen the harm after a breach happens.
Okay.
But as the sources really stress, preventing the breaches in the first place, that's the real goal.
Right.
And that means continuous training for staff, careful system design, really sticking to security rules. All that is vital to just minimize the chance of these breaches happening.
So what does all this really mean for you, the person listening right now?
Well, just understanding these risks and knowing what protections are supposed to be in place, that's really essential, whether you're, a patient navigating the system or someone working inside it.
Protecting this incredibly sensitive health information, it really has to be a collective effort, doesn't it? From the huge hospital systems down to every single staff member. And awareness, like we're trying to build today, that's got to be the first step.
Absolutely.
And as healthcare just keeps getting more and more digital, this focus on security, on privacy, it has to stay front and center. Your health information, it's incredibly valuable, and it really deserves to be protected rigorously.
Couldn't agree more.
Which kind of leads us to a final thought for you to mull over. What steps can you actually take? How can you understand how your own sensitive health data is being protected by the doctors, the clinics, the hospitals you use? Have you ever actually asked about their security practices? It is your information, after all, something to think about.